such as persons that engage in unhealthy sexual behaviors, such as having multiple sexual partners, having condomless sex with someone who isn't your stable partner, or you're not aware of your status, meaning HIV, and the HIV status of the other persons as well. Persons who use injectable drugs and share needles.
That was Dr. Keisha, the National STI Coordinator at the National AIDS Programme Secretariat (NAPS), outlining the risk factors of contracting sexually transmitted infections. She divulged that in excess of 6,000 diagnoses have been made for STIs as of 2020. This figure does not include HIV, which approximately some 9,000 Guyanese are living with. Some of the most common STIs in Guyana are hepatitis B, which is the third leading infection behind gonorrhea, and syphilis, respectively. Dr. Chin added that STI screening is currently available in every region at the primary healthcare level, as well as treatment for curable STIs, which include syphilis and gonorrhea. However, for hepatitis B, which is incurable at its chronic stage, NAPS has implemented supportive measures for those patients. Routine STI screening is crucial in preventing this disease from escalating from acute to chronic.
Recently, meaning earlier this year, we would have been able to not only get approval, but launching and distributing our treatment guidelines for to address the chronic form of hepatitis B, which is incurable. So if you have hepatitis B, the acute or early stages, that can be cured, that can be gotten rid of. Your body can rid itself of that. But once you move on to the chronic or prolonged stage of that disease, then you need treatment to better your life, as I would have, better the quality of life that you'll have.
The National AIDS Programme Secretariat is aggressively working to ensure STI testing is accessible to everyone in the administrative regions.
Is that eventually we'll get to a point where a person can turn up at any one of the health centers that falls within our primary health care level, and they are able to not only get an HIV test done, but they're able to receive some form of testing or screening for the other forms of STI. So first, you want to ensure that testing is available, it's accessible to persons that need it. You want to ensure that you will have the correct treatment policies and guidelines that aren't only applicable to our local setting, but that these treatment guidelines or policies are in keeping with what we're seeing internationally.
Sexually transmitted infections, STIs, are infections or diseases that are passed on during unprotected sex with an infected partner. Temika Rodney reporting for the HGB Nightly News.